Hello, cruel world. My name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Shahamanist. Now, this video is about 5 hidden signs that you might have PTSD, post-traumatic stress disorder. So I'm not talking about the obvious stuff. There's loads of videos out on YouTube about that. I think I've even done some. I'm talking about the subtle, clandestine, less obvious signs that fly under the radar. Also in this video, I'm going to tell you about what technically isn't PTSD, even though it might have similar symptoms, and why does this actually matter? And I'm going to tell you the difference between PTSD and phobia, and I'm going to give you a little insight into my work as an expert witness. So I'll explain it all later, but basically why you have to legally prove that something might be PTSD for compensation, and what happens if you don't do this properly. Okay, so just very briefly, in terms of my experience, PTSD is something I see very regularly. Although I'm a forensic psychiatrist and I work with offenders in criminal trials, I also do civil court cases, and there's loads of trauma in that. So I've assessed and given evidence for people with car crashes, clinical negligence, who literally lost limbs, people who have had stillbirths, people whose families commit suicide, that kind of thing. Grenfell Tower fire, I've done lots of cases in them. So I'll be mentioning some of these in this episode. So I just wanted to say that, I know what I'm talking about. Okay, before we get into the main course, as a little appetizer, let's start off with something very basic, very quickly, very briefly. What is PTSD? So PTSD is you might have heard the term bandied around, but it is like a psychiatric disorder. It's a reaction to a life-threatening event. It usually comes on within 6 months of that event. And the core symptoms are reliving the experience. That's usually flashbacks, more on those later, or nightmares. Avoidance behaviors. So if it was, I don't know, say a car crash, then you might avoid that type of car or that area of road or anything that reminds you or triggers those kinds of reliving experiences. And hypervigilance. So hypervigilance is always feeling on edge, even outside of that context of that car and that road. You just feel nervous, easily startled, maybe loud noises, etc. And finally, emotional numbness. I think you understand what that means. The most important part legally out of everything that I've said is for the diagnosis, it has to be life-threatening, and I'll explain why later in this episode. So I know you guys, you are kind of stats nerds and you want some stats, especially you college boy. So how prevalent is PTSD in the UK? Approximately 1 in 10 people in the UK will experience PTSD at some point in their lives, and around 4 in 100 people have it in the UK at any one given time, i.e. right now. Okay, so I've got a question for you, my Psych for Sore guys and gals. What demographic do you think have the most PTSD in terms of gender and age? So do you think it's old men? Do you think it's baby girls? Answer later on in this very episode. Okay, enough foreplay. Let's get into the subtle signs. Cue the music. First subtle sign that you might have hidden PTSD is that the scars on your arms are healing, but your mind isn't, i.e. you're preoccupied with an event and you can't move on. Now, I mentioned flashbacks before, and they're really obvious. So the flashbacks actually feel like you're back there in the trauma, in the event, in the accident. So it's not just thinking about it, it's actually like being transported back in time. If it's a car crash again, you're hearing the sounds of the window smash, you're feeling like physically the car crumple around you, you're feeling that sense of panic, you're actually reliving it. So that's obvious, right? Anyone can tell if that's happening. What's less obvious is when you have intrusive thoughts and ruminations, but they're fleeting. So you're so repulsed by the thought of the event, by that trauma, that you immediately push it out of the back of your mind. So it might not even register as a thought. It's because you're so embarrassed about it. Just like that bowl haircut that your mother gave you when you were 8 years old. So say you've had this serious car accident, maybe you've broken some bones, and maybe at the time you genuinely thought you were going to die. So most people would be upset by that, I think it's fair to say. They might be upset for days, maybe weeks, maybe even a couple of months. And you might have a reminder of that accident. Say you've got a cast on both arms as a reminder, especially if your mother has to tie your shoelaces. And especially if your sister has had to take on your toilet paper assignments. But when would this discomfort and these uncomfortable thoughts go? What's typical? A few months, maybe 6 months after the event? But what happens if you've gone past 6 months and you just cannot move on? So even though you're physically healed, if you've not mentally healed, then maybe without realizing it, you have PTSD. Number 2 subtle sign that you might have hidden PTSD is that you get agitated when you see the backside of a horse. bear with me, what I'm saying is that very specific scenarios make you unexpectedly and ununderstandably very anxious. So I'm talking about subconscious and obfuscated triggers. So let's say hypothetically you were taken hostage by a man with an AK-47 and he had a ponytail and he had some floral aftershave during a botched robbery at Greggs. If you've got PTSD, you might have obvious signs such as flashbacks when you see news stories of other hostage takers in the news, or when you smell cheese and onion pasties from Greggs. Smell my cheese. So there's a clear link between the original trauma and reliving this trauma. However, a more subtle hidden sign would be the subconscious triggers. So as I said, man in ponytail, you see the backside of an actual horse. His aftershave, you smell the slightly rotting chrysanthemums in the summer. So all of this, I'm doing all of this because I want to educate you about the subtle signs, but also because I wanted to use my favorite word ever, obfuscated. Speaking of hostage takers, if you're interested, go check out my other video, 5 myths about kidnapping, always be plugging. And I've even done a video about Stockholm syndrome with a very specific high profile case of somebody who even supported their hostage takers, even though they did horrible things to her and treated her in a very bad manner. She actually tried to stand up for them in a court trial. Go and check it out. Number 3 subtle sign that you might have PTSD is that you can identify all the emergency exits when you go into a grocery store. So I did about 50 cases as the expert witness as a psychiatrist for the Grenfell Tower fire. I'm not going to get into what that is. I'm sure you've probably heard of it. If not, go check it out. It's a horrific but fascinating case. And of all the clients that I assessed, the patients, several told me that they would actually check for fire exits wherever they went. So even though they knew logically there's a very little chance of fire, they knew it wasn't logical, but they couldn't help it. It was like instinct. When they go to a new place, they're looking at the fire exits, the escape exits, the escape routes. So hypervigilance is being very easily startled, and that's usually quite obvious, but sometimes it can be subconscious. So sometimes you could be doing it without even realizing you're doing it. So if you're doing that, if you're scanning the environment of every new place that you're going to, say a cafe or something, now it could be that you're a hard gangster and you have ops in your ends, but I can see through the screen and I can see you, and I think we both agree that you are wetter than a soft tissue. So alternatively, it could be intuitive, it could be a subliminal form of hypervigilance. Okay, before we move on, I've got a question for you, my Psych for Sore guys. I asked you before, what demographic do you think gets PTSD most? What age, what gender? So you might be surprised to learn this, but it's actually women aged 16 to 24. They're the most likely to screen positive for PTSD. I would have assumed it would be older men, but I was wrong. So if you got that right, buy yourself a cookie and you can bill me. Number 4 sign that you might have subtle hidden PTSD is that you're impervious to scented candles. What I mean is you find nothing relaxing. Before I get into that one, I just want to introduce you to this channel, A Schmite for Small Minds. It's a smorgasbord of videos related to mental illness, sometimes related to offending, because that's my speciality when I assess people in courts and prisons and psychiatric units as an expert witness. I've been doing these 5 myths or 5 signs videos. I've been doing some on depression, on bipolar, on hearing voices, on whether your therapist is good or not. Go chiggity, check it out. And I implore you to subscribe. Not only does it help me out immeasurably, but if you subscribe to my channel, you'll never have to spend more than 5 minutes on the phone with EE when you're trying to change your contract. The first person you speak with won't be a complete imbecile, and they will solve your problems immediately, and they won't transfer you to 7 different departments each time, you having to tell your story right from the beginning. Guaranteed all your money back. Okay, back to the video. 4th hidden sign that you might have PTSD is that you are impervious to scented candles. You used to love massages, but you hate them now. What I'm trying to say is you find nothing relaxing. You know the score. You've done an hour of yoga. You've nailed child's pose. You've decimated sleeping dog. You've killed crouching tiger and hidden dragon. You've completed all the ASMR videos on YouTube. You've listened to Coldplay's greatest hits album twice, but you just cannot relax. In fact, you dodge massages like Neo. Sometimes anxiety and hypervigilance can be clandestine. So it's not always an obvious, overt feeling of being anxious, but it can actually be the opposite. It can be not feeling actively anxious, but the inability to shut off. So I wanted to educate you about this subtle sign of PTSD, but I also wanted to use my favorite ever word, clandestine. Okay, a quick question for my Psych for Sore guys. Have you experienced PTSD? What was it like? What did help or what didn't help? What would trigger things? Let me know in the comment section below. Okay, let's keep it going. Just one more sign left. You can do it. Get your back into it. The fifth subtle sign that you might have hidden PTSD is that rain makes you weep. So emotional numbness is a core sign of PTSD, but I've seen occasions where my patients get most emotional numbness, but instead of being really obvious with something that's kind of felt in the front of your brain, you have this sudden, inexplicable emotional flooding for reasons that you can't pinpoint. And there's bizarre triggers. So I've had more than one patient in my career, not very often, but more than one, maybe 2 or 3, that have told me that they've become emotive and they've become sensitive due to the weather. So if sunshine makes you sing, if rain makes you weep, maybe it's not just because your great-great-great-grandfather was a shaman, voodoo rainmaker who angered the sun god. Maybe it's because you've got hidden, deep down PTSD. Okay, the myths are over. I'm going to address a new, potentially controversial, quite niche, but I think interesting topic. I think it's interesting. It's not often talked about. I don't think I've ever seen a YouTube video about this, and it's directly related to my line of work as an expert witness in civil court cases. And my purpose, of course, to make these videos is to educate you, also to take over the world, but I don't think that is going very well. And that topic is, what isn't PTSD? So I've seen multiple cases where somebody has had a trauma and they've had some similar symptomatology of PTSD, but they don't technically get that diagnosis. So what do I mean? Maybe you've got a primal fear of rodents. Maybe you've experienced a trauma when you were 11 years old. A particularly vile, venomous, volatile, vicious hamster bit you at a sleepover at your least favourite cousin's house. Vein Vicodin, ring, 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 sorry. But that won't be considered PTSD by definition according to ICD, because in ICD, one of the diagnostic criteria, this is the definition, and I'm quoting here. This arises as a delayed and or protracted response to a stressful situation or event, either short or long lasting, of an exceptionally threatening or catastrophic nature, which is likely to cause pervasive distress in almost anyone, e.g. natural or man-made disaster, combat, serious accident, witnessing the violent death of others, or being the victim of torture, terrorism, rape, or other crimes. End quote. Okay, I admit the hamster bite thing, I was being a bit facetious as an example, as a comic effect, but in my clinical experience as an expert witness, I've seen some other serious cases where undoubtedly it has been traumatic and upsetting, but it's not been, and I quote, exceptionally threatening or catastrophic nature. What am I talking about? So for example, somebody being relentlessly bullied at work, or there's one case that I saw where somebody a clinician had taken blood from somebody else and they did it really badly, basically, and there's a massive hematoma. It's really painful. Patient fainted because of the blood, blah, 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 burst a vein, led to a hematoma. So what I'm trying to say is that I've seen scenarios where somebody's definitely been traumatized, but it's not exceptionally life-threatening. So does it really matter? Well, yes or no. It matters for the patient because they're still having the symptoms. And just to be crystal clear, I'm not minimizing their suffering. However, the point I'm trying to make is, in reality, unfortunately, they might not get the treatment. So because it's not formally PTSD, because it's not life-threatening, they might not get that diagnosis, and the NHS might not think that even if their symptoms are serious, they might not think that the trauma was serious enough to diagnose them, and therefore they don't get this treatment. So, for example, they might not get therapy on the NHS. Probably they could find a private therapist, but obviously you have to pay for that. By the way, see my video on 5 signs that you might have a bad therapist, which includes a little breakdown of the disadvantages of getting therapy on the NHS. Always be plugging. So simply because the NHS is so overstretched, they might prioritise more serious trauma. So just kind of moving on, in my line of work, so I might give evidence as a psychiatrist to diagnose an individual who's been through a trauma so that they can use my report as evidence in a civil court case, and they might get compensation. So what I'm saying is I help an individual through a solicitor who's suing like a company or an individual. And I've done lots of different cases. I've done extremely tragic cases. I've done medical negligence that's led to stillbirth, and the NHS is suing the individual trust for compensation. And I've done maybe, I don't know, 12, 20 cases of very severe life-threatening car crashes where the individual is suing the insurance company, not the NHS. As I mentioned before, I've done the Grenville Tower fire where the individual is suing the council for having the poor cladding which allowed the fire to spread. So in all of these cases, as long as they have the relevant symptoms, and I have to prove this, not just by assessing the patient, that's an important part, but also looking at the medical notes, do my own assessment, I can make the case for post-traumatic stress disorder. And it's very easy in all of those cases, Grenfell Tower car crashes, to argue that it was an exceptionally threatening or catastrophic nature. However, in other events that are still traumatic, such as bullying at work, and the individual is suing the company that employed them and the bullies, it's harder to make this case. So I just want to be absolutely crystal clear to preempt any aggressive YouTube comments. So I'm not sure if you know this, but the internet is not renowned for the most level-headed opinions. I'm not saying that if an individual has been bullied at work that they aren't distressed, and then I'm not saying they don't deserve compensation. And perhaps they do have another diagnosable disorder like an anxiety disorder or a phobia. But what I'm saying is this, finally getting to my point, is that I cannot make the case formally for a diagnosis of PTSD if it's not exceptionally threatening or catastrophic in nature. So the main reason, of course, is that I have to be honest and I've got a duty to the court to be objective, but also what would happen if I didn't do that? So hypothetically speaking, if I erroneously made this diagnosis of somebody being bullied at work of PTSD, maybe because I felt sorry for the patient, why is that a problem? Because civil court cases are all about the money. Cash rules everything around me, cream. So the people being sued, the company, whatever, they will fight to the death to argue against their against the compensation. So they might instruct their own expert who will do their own independent assessment. And with that information, the barrister for the other side, who's working for the defendant, so not the claimant, the defendant, they can aggressively cross-examine me in court. So it might sound like this. And by the way, this is what all barristers sound like. Dr. Das, are you aware of the ICD-11 criteria for PTSD? Can you honestly say that being bullied is exceptionally threatening or catastrophic in nature? Dr. Das, you claim that your patient has flashbacks, but there's no objective evidence of this within the medical notes. So what I'm saying is, if my evidence is weak, then the entire case can be thrown out, and the client might end up getting no compensation. Whereas if I didn't make the case for PTSD, but a lesser anxiety disorder, they could have got a lesser amount of compensation. So I might have wasted the money and the time for the client, for the patient, for his solicitors, and I could actually in the end be harming his case rather than helping his case. Again, just to be crystal clear, I would never do this in court. I'd always be honest and objective, but I'm just explaining why, in a very rambling way, and I apologize for that, it's important to get the criteria exactly right and not misdiagnose something, because you can actually end up hurting, not helping the case. Okay, kids, to finish, let's summarize what we've learned today. There are lots of hidden signs of PTSD. They can include very specific scenarios making you unexpectedly anxious, like seeing the backside of a horse. I've talked about subconscious and obfuscated triggers, so things that you're not consciously aware of. I've explained that hypervigilance can be subtle, so not the obvious hypervigilance is being easily startled, but it can be subconscious. You could not even not realize that you've got hypervigilance. For example, identifying all the emergency exits in a grocery store. We learned that your sister had to wipe your backside for 3 weeks. We learned that emotional numbness is a core symptom, but occasionally you can get patients where this emotional numbness comes out in this inexplicable emotional flooding for ununderstandable reasons or bizarre triggers like the weather. We learned that you had a frankly shocking bowl haircut when you were 8 years old. And we learned that if you've had a serious trauma like a car accident and you can't move on after several months, even though you're physically recovered, you might not even understand that you're being preoccupied with it, but it could be there subtly in the back of your mind. It could be hidden that you've got PTSD. Okay, before we finish up, before I leave, I've got you a quick couple of questions for my Psych for Sore guides. It's basically about requests that you might have. So what are the psychiatric conditions you would like to know more about? What topics would you like me to make videos about? Do you like the myths topics? Do you like the subtle sign topics? Do you have a preferred format? Let me know in the Schmomich section, because I got you. Have a blessed day. Buy my goddamn book, and do not forget, I love you. Also, if you're interested, I'm going to be in CrimeCon in September. I'll put some more details about that in my social media stuff. Peace.